Drug-induced kidney injury is increasingly recognized as a significant contributor to kidney disease, including acute kidney injury and chronic kidney disease. Kidney injury, also known as nephrotoxicity, has a wide spectrum reflecting damage to different nephron segments of the kidney based upon individual drug mechanisms. Both glomerular and tubular injuries are recognized targets for drug toxicity and may result in acute or chronic functional changes. The clinical manifestations of drug-induced kidney injury often go unrecognized, particularly in the setting of short drug exposures. This poses challenges in assessing the incidence, severity, and long-term consequences of drug-induced kidney injury. In this video, we will talk a little bit about drug-induced kidney injury with a focus on acute intrarenal injuries. The information presented in this video should not be used for diagnosing or treating a health problem. Consult your healthcare provider before making any changes to your health plan. Remember to subscribe to this channel so you can be notified of more pharmacy and medicine related videos. So first we'll discuss a little bit about what is drug-induced kidney injury and provide some facts. Drug-induced kidney injury is a frequent adverse event which contributes to morbidity and increased healthcare utilization. Our current knowledge of drug-induced kidney disease is limited due to varying definitions of kidney injury, incomplete assessment of concurrent risk factors, and lack of long-term outcome reporting. It's also increasingly recognized as a significant contributor to kidney disease, including acute kidney injury and chronic kidney disease. Chronic kidney disease develops gradually over time. Drug-induced kidney injury can be pre-renal, intrarenal, or post-renal. In this video, we will focus on acute kidney injury and the intrarenal types. Other names for drug-induced kidney injury, you could hear some of the following terms like drug-induced kidney disease, drug-induced nephrotoxicity, drug-induced renal disorder, drug-related kidney injury, or drug-induced renal failure. Now let's talk about drug-induced acute kidney injury. So this is the acute form of kidney injury, not the chronic. Drugs are relatively a common cause of acute kidney injury in hospitalized patients and those in the intensive care unit. Drugs are associated with acute kidney injury in 14 to 26% of adults in prospective cohort studies. Drug-induced renal disorders are more common in certain patients and in specific clinical situations. For example, those patients that have intravascular volume depletion, diabetes, congestive heart failure, already have chronic kidney disease, and sepsis. Infants and young children are also susceptible to drug-induced acute kidney injury, especially if they have extracellular volume depletion, sepsis, renal impairment, cardiovascular disease, diabetes, prior exposure to radiocontrast agents. Some of the symptoms of drug-induced acute kidney injury include decreased urine output, swelling, fatigue, nausea, and drug in urine. Some of the complications of the disease could include electrolyte imbalances, acidosis, uremia, and development of chronic kidney disease. As I mentioned before, kidney injury can be pre-renal, intrarenal, or post-renal. In this video, we will focus on the intrarenal forms, which are primarily due to direct injury or some sort of inflammation. The pre-renal types of kidney injury are usually due to blood perfusion, mainly based on decreased blood flow to the kidney and its decreased glomerular filtration rate. Post-renal type could include a direct effect on the bladder or the urinary sphincter, for example. So those are another type, but again, we'll focus on intrarenal. There are numerous mechanisms for drug-induced acute kidney injury and can involve one or more of the following: impairment of blood perfusion to the kidney, inflammation induction, or free radical formation, in other words, direct injury to the kidney tissue. The three main categories of acute kidney injury include proximal tubular injury and acute tubular necrosis. These are dose dependent, meaning the higher dose you take, the greater risk of injury or greater extent of injury you can have. This type of injury is via apical contact with drugs or their metabolites, the transport of drugs and their metabolites from the apical surface, and secretion of drugs from the basolateral surface into the tubular lumen. So this is due to direct injury of the kidney tissue. Another type of acute kidney injury is interstitial nephritis, induced by a drug or its metabolites. This is dose independent, meaning the amount of drug you take will not impact the extent of the injury. And interstitial nephritis is due to an inflammatory or immune response. A third type of acute kidney injury, though less common and is dose dependent, is tubular obstruction. This is formed by the development of crystals or casts containing drugs and metabolites which are not soluble in the urine, thus leading to obstruction. Now let's look at which medications can cause drug-induced acute kidney injury. According to the GoodRx website, below are the top 10 medications or medication classes that can lead to kidney damage. And these include NSAIDs, diuretics, ACE inhibitors, radiocontrast dyes, vancomycin, aminoglycoside antibiotics, certain HIV medications, along with other antiviral medications, zoledronic acid, and calcineurin inhibitors. On the right side, there is a summary of these different types of drugs and which part of the kidney they affect. So you look at the level of the nephron, the action that it causes, and the drug. So if you look at the example of aminoglycoside and radiocontrast dyes, they have an effect on the proximal tubules and they cause acute tubular necrosis, which is again direct kidney injury. On the bottom right, it's a nice diagram that shows the different areas where various drugs can affect the kidney, for example, affecting the blood flow before it even reaches the kidney, effect on glomerular filtration, interactions with the tubules of the kidney and the collecting duct, and so on. So it's a good diagram to analyze. Now let's look at prevention and treatment. Firstly, for prevention, as a precaution, if the patient has had drug-induced acute kidney injury in the past, don't administer the product. Make sure the patient is adequately hydrated. Don't use a higher dose or longer duration of therapy than required. Ensure that when a nephrotoxic drug is being administered, you do perform baseline renal function monitoring and also throughout duration if there is long-term use. You could examine the GFR, calculate that, and also throughout therapy you can look for renal toxicity biomarkers. I listed some examples here, some urine proteins, KIM1, NGAL, type 4 collagen, osteopontin, and clusterin. And lastly, if you do see any symptoms of signs or symptoms of nephrotoxic effects, then do consider discontinuing the product or reduce the dose at a minimum. In terms of treatment, this may vary by the type of the kidney injury. For example, if it's a direct injury or if it's due to inflammation. First of all, remove the causing agent. Monitor the GFR and the blood pressure, make sure the patient is adequately hydrated, and then manage other symptoms and provide supportive care as required. I hope you found this video educational and useful. Please remember to like and share. Thank you.